All right, we are going to go ahead and get started. I'm sure some others will gather as we get in the room. Sometimes this starts to happen as we get into the summer months. June already starts to get a bit crowded, but we are recording this call and we'll be sharing it with the network afterwards as well. Hi everyone, for those of you who don't know me, I'm Autumn Lerner, Senior Director here with Pandemic Action Network. Nice to see you all. Thank you for turning your cameras on. It makes me feel a lot less lonely and in the world. You're also probably very familiar with seeing our dear chair of this meeting, Darcy Swatsky. Darcy has laryngitis today, so I am acting as her voice. I will do my best, but Darcy is very present and with us. Thank you, Darcy. And we've got two excellent speakers today, as well as some updates from Pandemic Action Network that we want to share. And we'd love to do a round robin. Wow, everybody is on camera. Fantastic. This makes me so happy. So you'll see the agenda is in the chat. Please feel free to kind of put your introduction and where you're streaming in from in the chat as well, in terms of your location in the world. In terms of the agenda, after our speakers, we'll have some time for Q&A after each session, and then we'll also have some time, as I said, for a round robin, and then updates from the network. Namely, the timing of this call is going to shift by 2 hours earlier, starting next month, so that we can greater accommodate our partners who are around the world. But we have a very robust group of partners in Africa and in North Africa and the Middle East. And this time is very late for them. And so, as we do with the network, often our calls end up earlier for those of us in the US, so that we can accommodate a greater diversity of partners around the world. So stay tuned for that, and we'll actually walk you how to change your registration for this meeting. But without further ado, I would like to actually just turn it over to our first speaker. We've shared information about their new vaccination toolkit for community health workers before, but we're really thrilled to have Semay here to talk us through in a deeper dive. So Semay Johnston from Digital Medic, an initiative of Stanford Center for Health Education. Over to you.
Thanks so much. And I'm actually pleased to be joined by our medical director, Victoria Ward. So we're going to both present about the toolkit today. So yeah, thank you so much for taking this time. Let me share I'm not able to share my screen. Is someone able to give me permission to do that?
I'll work on giving you permission now, thanks. And Darcy has your slides and should be able to share them. Darcy, give me a quick heads up if you can do that, but I'll work on screen sharing.
Perfect.
I got the nonverbal thumbs up from Darcy. Hopefully we'll start to see those. Here we go. Excellent. Thanks, Darcy.
That's great. So yeah, thank you for the time and the opportunity to share about this project. I'm the Learning Experience Director at Digital Medic, and our team worked really hard on this toolkit. So yeah, Vicki and I are going to share a little bit about it today. If you could go to the next slide, I'll give you a little bit of information about what we do at Digital Medic. As you mentioned, we're an initiative of the Stanford Center for Health Education, and we envision a world where all communities have access to engaging, evidence-based, and actionable health information. This vision guides our mission, which is to improve the health of global communities by advancing the field of health education, building capacity for the health workforce, and expanding information equity worldwide. Our expertise is in translating complex health information into rich learning experiences. And we work with a wide variety of groups to train frontline providers, educate our most vulnerable communities, and understand the impact of our health education initiatives. So at this point, we're going to tell you about the Supporting Vaccination Toolkit, and I'm going to hand off to Vicki to introduce it and share some background on how it was developed.
Thanks, Semay. As you all know, we are a group of people who've been working to address the pandemic for the last 3 years. And one of our best allies in doing so have been community health workers, who are the trusted and reliable sources of information for many of our communities globally. And so in developing this course, we partnered with community health workers to understand both what their needs were for training and also ways in which they wanted to improve their communication with the communities that they serve. So this is one of the quotes that we learned from a community health worker who works for One to One in South Africa. What I love is that when we went door to door in people's houses, we tried to explain about vaccination, and then people went in numbers to vaccinate. So what I'm trying to say is that after educating people about the vaccine, they went out in numbers to vaccinate. This means that we also have a huge impact. So this is sort of the driver of this course. And if you go to the next slide, I'd love to introduce you to our CHW educator who was built with community health workers. Her name is Sarah, and she'll tell you about the course better than Semay and I probably could. If you can start the video, hopefully it'll work. Darcy, are you able to start it, or is it not working?
Connected to teams and have the power to mobilize.
We can hear it, but we can't see it. Sometimes you have to like click all the little boxes at the bottom and redo it. There we go.
Community health workers, or CHWs, provide trusted life-saving care for millions of people around the world. They are deeply connected to their communities and have the power to mobilize millions of people to get vaccinated against COVID-19 and other infectious diseases. But they need the right support and resources. Knowing this, we worked with community health workers to create a free digital vaccine education toolkit that can be accessed worldwide, even in low bandwidth settings. The Supporting Vaccination Toolkit equips community health workers with essential knowledge and empathy-based communication strategies to ease fears and inspire confidence in vaccines, ultimately increasing vaccine acceptance in their communities. Created by Digital Medic, an initiative of the Stanford Center for Health Education, this toolkit contains 10 mobile-friendly videos, as well as audio files and graphics that community health workers can review at their own pace. The toolkit covers the basics of vaccines, immunity, and side effects, and ways to answer common questions and locate reliable information. It emphasizes the importance of exchanging personal stories and exercising self-care while caring for others. Recognizing that vaccine acceptance is a spectrum, this toolkit helps community health workers meet people where they are and guide them through the vaccination process. Access and download the free Supporting Vaccination Toolkit on the Digital Medic website, mobile app, or YouTube channel.
Thanks so much. We can go to the next slide. Great, thank you. So now we'll turn attention to how and why we developed the course. As we are all familiar with the mistrust and misinformation around the vaccine. Oops. Great, thank you. So in sort of early in the pandemic, we were all sort of working on how to best address the mistrust and misinformation around the vaccine that was rampant everywhere in the world. Our research had showed that people were willing to listen to community health workers whom they identified as trusted sources of reliable information. CHWs were generally serving as the primary educators regarding the vaccine to patients and families, but they generally reported that they didn't feel like they had enough support, including training and information, to feel comfortable with these conversations. So this course was built for them and also with them. To do this, we worked with an advisory group of CHWs to understand what their needs were, to really understand what the barriers they were learning about in the community were, and to ensure that all the materials were relevant and actionable for their day-to-day work. Next slide, please. So when we asked about barriers, both for them and in the community, we really did a lot of listening sessions to understand what people were experiencing. These were held with some of our community partners in South Africa, both Polani and one-to-one. Some of the key reported barriers to effective vaccine outreach were strong feelings of vaccine-related mistrust in the community, lack of reference materials for educating community members, lack of vaccine-related training opportunities, concerns that CHWs felt like they didn't have enough access to trusted sources for reliable health information. They said they felt they lacked the scientific knowledge about coronavirus, about the vaccines, about side effects, and the ways in which they should be addressing the common concerns that they were hearing from their families and patients. And then they had their own fears about vaccination, which they weren't sure how to reconcile in those conversations. Some of the quotes we heard were, we found ourselves in a predicament because they were always fake news, which we were unsure about which ones were true or which were untrue. Another was, I never received such a training about vaccination, what it is and how it works. A third said, we were nervous to go because that maybe we die after receiving the vaccination. There were rumors on possible side effects, so we were afraid. Next slide. Great. So with these challenges in mind, the Supporting Vaccination Toolkit was designed to equip CHWs with knowledge and competence to educate communities about the importance of vaccination and to guide people through the vaccination process. The toolkit was primarily focused on COVID-19, but the materials are in general general enough that the concepts and training are largely applicable for other immunization training needs as well. The main goals for the toolkit are to provide a clear understanding of how viruses infect the body and how the vaccines function, to provide some communication methods for vaccine-related education, especially around their benefits and addressing misinformation, to give some ideas about methods to assess vaccination readiness and to match the behavior change communications to that readiness stage, and then ways in which to encourage concurrent prevention strategies. Next slide, please. So turning to the specific content of the toolkit, it contains about 10 animated videos. They're available also as audio-only files, and then has a complementary set of static graphics. All of these are shareable via mobile chat platforms like WhatsApp. A subset of the content can be used as job aids to share with patients and communities to support communication. There's about 100 minutes of content, and the specific topics are the power of your story, which talks about the importance of storytelling and behavior change communication. Virus and Vaccine 101, which is about both sort of physiology, pathology, and then the mechanisms that the vaccines use for their function. Some side effects and adverse events discussion around the vaccine. Understanding special concerns, really kind of addressing those sources of misinformation, talking about beliefs and values, moving from empathy to action, working on sort of moving along the spectrum of behavior change, sources and sharing trusted information, and then supporting those who are ready to vaccinate, talking about prevention, and then of course, self-care for community health workers. So now I'll hand it over back to Semay to talk about the ways in which the content was designed and the sort of mechanisms that went into that design.
Thanks, Vicki. So our ultimate goal for the toolkit was to make sure that it's accessible in a number of different ways. So making sure it's appropriate, acceptable, approachable, affordable, and available. To start, these as Vicki already described, we went to great lengths to make sure that the content covered in the toolkit was appropriate, aligned with the CHW experience, addressed gaps that we identified during the landscape analysis, and included the critical knowledge and skills that experts, which included the CHWs themselves, identified as important for increasing vaccine acceptance and vaccination rates. If you could go to the next slide. We also wanted to ensure that the information was acceptable. We sought to understand the socio-cultural context through the CHW's input and social listening reports. So this allowed us to better understand the CHW experience, trends and misinformation, expressed beliefs, values, and traditions in the communities, as well as what common interactions with clients or patients would look like. Next slide. So when we designed the visual look and feel, we also wanted the content to be approachable to learners. We employed a character named Sarah, who is a fellow CHW. She narrates concepts and tells her own story and guides learners through sample client interactions. And as Vicki mentioned, she's a character that had been co-developed with an advisory group of CHWs for a previous course on advocacy. We've had pretty good feedback on how she resonates with this target audience. Next slide. So throughout the content, we used simple icons and relatable metaphors to make concepts more digestible. This simple style also allows us to keep the file sizes lightweight, which is really important for accessing the files in low bandwidth settings. And we've translated the content from English into 4 additional languages: French, Spanish, Sepedi, and Xhosa. Next slide. So as Vicki mentioned, all of the content is available to download and to stream on a number of different platforms. So we have our website, the mobile app, and YouTube. You can download the files in video format and audio only through the website. And the mobile app is really useful for accessing the content offline in low bandwidth settings as well. You can download all the files to your device and view them in there. We also have, in the next slide, you can see kind of what that interface looks like. If you were to download, say, one of the infographics through the website, you could click on a button, open up an interface where you can choose the resolution and the file type and have that available to share if you wanted to share it on WhatsApp. And all of these are freely available and using a Creative Commons license. So next, I'll just pass it back to Vicki to share some opportunities that we see for the toolkit.
Thanks, Semay. I think in the vein of it being openly accessible and free, we're keen to just have this be used. I think that it was really designed to prevent the pandemic, and this is a great network for that purpose. So I'm keen for anybody for whom it's useful to download it, share it, tell others about it. And most of all the work that we do includes research. And so we really work to use rigorous methods to evaluate both who's using it, how it works for them, and also really trying to understand how does it change knowledge, attitudes, and behaviors. And so we have many a research project all around the world and are always keen to partner research. And then finally, we are now iterating from this process to turn attention to routine immunization and really preventing sort of the host of childhood illnesses. And so we have projects in Africa, Latin America, multiple places where we are now using some of this content and then creating new content that's similar for routine immunization encouragement. I think overall, next slide, please, partner with many different groups, community health organizations, nonprofits, funders, multilateral organizations, really in effort to create efficiencies of scale. And we think partnership is both key to that, but also hope to sort of use the skill set of the digital group for ultimate purpose of improving health. And so I would love to be in contact or discussion with anybody who's keen to partner. And all of our sort of information is on the left side, and look forward to discussing further. Thanks for the opportunity to present today.
Thank you, Victoria. Thank you, Semay. We'll open it up for some quick questions. You wrapped up on the point that I was most curious about in terms of the how does this translate into, lessons for community health workers, particularly around vaccination moving forward, because COVID is specific to building that openness and acceptance around adult vaccination and specifically around COVID. But we're already seeing around the world, and there actually was just a study that came out this week, and I'll put the link in the chat, around declining vaccine acceptance and attitudes around vaccination around the world. This study was specifically for Africa, but we've seen similar data in the US of, attitudes around vaccination and refusal going down in the US and also in the global north, but now we're seeing that around the world as one of the ripple effects of the pandemic. So it's good to know that you're kind of translating into that faith. My other question, it's great to see the robust partnerships. How are you working with partners to kind of co-create this material? I'm sure you talked about listening exercises, that it is probably in partnership with partners as well. I'll start out there, and then if anyone else has questions, feel free to raise your hand or feel free to drop a question in the chat, because we'll be going to our next speaker here shortly.
Yeah, thanks, Autumn. I think absolutely everything that you spoke to is really what our attention has been on as well. I think I'm a pediatrician by training, and so I see the sort of ripple effects quite often in terms of the general increase in hesitancy around vaccination. And so even communities that were typically vaccine acceptant, there is significant changes in their acceptance and now their hesitancy, both in terms of the vaccines specifically, but also in terms of particularly in lower resource settings, going to medical settings, facilities where they might get vaccination. And so we're seeing the general decline in vaccination rates. That's really concerning. And I think we're starting to also see increases in things like polio and measles that were largely moving towards, hopefully someday, eradication. I think in trying to address those concerns, we find that a lot of the communication strategies, the behavior change communication, the ways in which to address misinformation and sources of hesitancy are really applicable across all of the diseases that the immunizations aim to prevent. And so we're keen to leverage the lessons learned and the benefit of the supporting vaccination toolkit to do that for routine immunization. And we know that a lot of our community health partners are really keenly focused, particularly on zero dose infants, but really on vaccination in general and addressing those of our burgeoning sources of hesitancy. So keen absolutely for that. I think with regard to partnerships, we have in two of our sort of biggest projects we're working on right now, as mentioned, one with Lawala in Kenya and another with WUKU and WUKU Kuak, which is a community health alliance in Guatemala. We really co-develop all of the materials that are focused on specific sources of hesitancy, concerns, barriers to vaccination in their community. And to do that, we do focus group discussions and IDIs to really understand both what are the primary concerns for community members, but also what are CHWs hearing, what are their reservations, what ways in which do they prefer to communicate, that they feel like are having impact in the community. And so it is a process both of co-developing the messages and then also, as Semay can speak to, the ways in which that content is then developed, both the look and feel, the communication strategies, and ways in which align with the community members' receipt of information in hopes of trying to the extent possible, create as much impact as possible. Semay, anything to add on the sort of co-development process?
Not a lot. I mean, I think it's really important to hear the specifics of what, those partners are hearing are important to address and how to create the content. But we are seeing a lot of commonality across these different locations. And so that's been really interesting to kind of be thinking about this in a global context, and also seeing the relevance of, this kind of content also still the supporting vaccination toolkit was designed to be, standalone. You can take it in any order. So there are pieces in there that I think are still really relevant to routine immunization, like the communication techniques and the ways of addressing misinformation. We try not to get into all the nitty-gritties of every single myth or misinformation out there, but kind of equipping people with the skills that they need to navigate those difficult conversations and help people move toward acceptance of a vaccine. So I think, yeah, there's a lot of commonalities, and also just really making sure that the CHWs or the healthcare workers who are in those specific situations have the skills that they can use to address those more localized challenges and barriers.
Great. Thanks, Semay, and thank you, Victoria. I think that's a great place to wrap up there. I see Darcy also put a question in the chat for you. Encourage others to drop any questions in the chat. But I think that's also a good way to tee up our next speaker, Carrie, just to really talk about the importance of communications and the communications lessons from the COVID pandemic. Estelle Willey at the Rockefeller Foundation recently wrote a piece for Stat News on the 4 communications lessons from the COVID pandemic learned the hard way. And Carrie is her partner at Hattaway Communications, that they really worked throughout the thick of the pandemic together on communication strategies. And so Carrie's going to be speaking to those lessons, but also really actioning them and translating them, because I think what we're seeing in Pandemic Action Network is we're really making an effort to ensure that lessons just aren't documented, but they're actually learned and actioned, is that the communication side of systemic change and reform is often left by the wayside. It's like the last thing that people think about when really comms needs to be in lockstep and at the beginning in terms of how we think about, Paul, I see you on the line, the experience of people and audiences, and like the role that message plays in really getting people on board. So Carrie, over to you.
Yeah, thank you all. And Darcy has my slides, which are really the research that we did hand in glove with Rockefeller that underpinned the 4 lessons that Estelle laid out in the piece. So I'm going to kind of give you color commentary, and you can obviously read the piece itself to really dig into it. So Rockefeller came to us in August of 2020, and it was sort of right after the initial, when we all realized we were kind of in this for the long haul. And so over the course of about 18 months, we did 6 waves of a survey with the American public. So it was balanced with the American public with oversamples of key audiences, Black, Latino, and frontline workers throughout the thing. And so one of the key lessons is don't assume the science is enough. And there's some really interesting the really clear example of that, if you can go to the next slides. We did these 6 waves. We matched them with how many cases there were this was our last wave. So, there were a lot of cases, but they were sort of percolating along. And then the Omicron wave hit. So the data we're going to share on the next slide was from that last wave when there were 1.5 million cases a day. And this is how people were reacting to that, which you'll see. I don't want to bury the lead. The real lead, which we led with in the piece, is most people did most of the right things most of the time. And that was not the story that you typically got in the media, right? The media was focusing on the loud voices, the loud and vocal minority who were not doing things, or the public health thing, which is, if we don't get 95% of people vaccinated, it's not going to work. But the reality was, lots of people immediately and drastically changed their behavior and kept it that way for a long period of time. But it was not really linked with the actual risk. So this is the rolled up data from all 6 waves. In February 2020, when there were more cases than there had ever been, they were actually the lowest numbers that we had ever tracked. Now, not hugely lower, but right in August, when everyone was sort of bustling around thinking they were going to be effective and this was all going to be over by Christmas or whenever the vaccine came out, we had 80% of people saying, I mean, this is when we thought washing hands was actually like super important too, right? But so we tracked these same items across the whole thing so we'd have comparative things. But people were wearing, the question was, we always get asked this was not, we were tracking people in real life, seeing what they did. This was, how willing are you to do these things that you're being asked to do? So these were the very or considerably willing people. 2/3 of people willing to wear a mask. It was down to about 60% by the time when they really all needed to be wearing masks. But that's still 60% of all people taking what was an extremely non-consumer behavior, something that was never something Americans did when they got sick, doing it, continuing to do it. I didn't include it in this deck, but we said, what are you going to keep doing even after the pandemic? And most people say, when I'm sick, I'm going to wear a mask. It's a thing now that we've all adopted as a piece of work. So 2 things that are in our summary. One is, and also what the Stanford folks just says, talk to your community. Like, don't rely on the headlines, get in underneath them and really ask and talk to real people to make sure that you're getting the full story, which is what we did and why this tracking study was so important. But also don't assume that just, oh gosh, the risk is higher, everyone's going to automatically know what to do, because people get numb. We are not actually all rational actors in lots of these things. The second part are about messengers and messaging. And here's why those trusted, reliable messengers, as you just saw from the Stanford work, are critically important, but also the tested messaging. Do people process what we want them to hear the way we think they're going to? So these were some really fabulous research that we did, where we asked people both, what was clear to you during the pandemic? So I'll start there. How clear was it? And again, most people found most of it pretty clear. The problem was, and that's why some of these are highlighted. So the 3/4 of people said, yes, I get when I'm supposed to wear a mask, but only 63% of them were clear on what kind of a mask to wear. So we told people what to do, but we did not make it really easy for them to actually do it. And if you think of it yourself, think of all the news coverage and a lot of the public health guidance, everyone should be wearing a mask. What you should wear is a K95 mask, but those are really hard to find. If you order them online, you don't have any sense that they're actually, you immediately undermined people's confidence that they knew how to do this. And people reflected that. There are some folks that said, just, wear a mask. Any mask is better than no mask. Wear the best mask you can find. That probably would have been better messaging and more people, because then people threw up their hands. They don't really know. I don't know. Am I doing it wrong? I don't want to do it wrong. So maybe I just won't do it at all. And the same with testing. Lots of people, again, 2/3 of people, very clear when they should get tested, extremely unclear or significantly less clear is probably a way to say that, about which one to get. Because again, you said, if you think you might have COVID, you should get a test. And then PCR and this and that, get tested, something again. We immediately made people worry that they were doing it wrong, or the test that they got wouldn't actually tell them anything that was useful. So this is why, again, that tested messaging of how do you talk to people about these things and the people from whom they heard them, because a lot of stuff was unclear. And then we asked it a different way. And the different way, we got to a more emotional reaction. What was frustrating to you? And people were very frustrated by a lot of things. And the highest thing they were most was the conflicting information, right? So I'm trying to figure this out. I go to all these trusted sources. They're all telling me different things. Why can't you people get your act together? What I also thought was interesting was, you heard a lot in the media about how frustrated people were about COVID protocols. You saw the protests in the stores about people being asked to wear masks, or, reports of people quitting their jobs because they didn't want to get vaccinated. What we actually found was the second most frustrating thing was other people's lack of adherence to COVID protocols. So people were doing it, as we saw from our earlier slide, and they were really frustrated that other people weren't. That was not the story you were hearing. You were hearing that everyone had this right to sort of protest all this stuff, but really people, everyone's trying to do the right thing, and they were frustrated that other people were not doing it. And again, the other thing, and this really reinforced it, if you go down to see the requirement to get vaccinated, that was frustrating to 20% of people, which is not nothing, but it's not the majority of people throwing up their arms and being extremely frustrated about being told to get vaccinated or required to get vaccinated. So again, this is this mix of messengers and messaging and really unpacking what is going on there so you can communicate clearly. Oh yeah, I did include this. Okay, so then we said to people, what would you keep doing? Which that you've adopted in the pandemic do you hope will continue? This is like the slide that gives us all hope that we actually got through to people. This idea of staying home when you're sick, wearing a mask, self-isolating, wearing a mask on public transportation. A lot of people have institutionalized these. I see it in DC all the time. I started after 3 years of not really taking the metro again. A lot of people on the metro are still wearing masks. And they take them off when they get off the metro, but I'm in a closed thing around a lot of people. This might be a smart thing to do right now. And then the last part of this is again, why all of this sort of messaging and understanding your people and the mindset they're bringing to the actions that you may be asking them to do. This was, again, after 18 months of this work, we said, you can't really tell who is in favor of public health anymore by looking at vaccine status. People have gotten much more sophisticated than that. And when we did the cluster analysis of our data, we saw there are really 4 types of people in America by the end of, again, this was last spring, that they're what we called frontline defenders. These are people, they're doing everything, right? They're wearing the mask, they're fully vaccinated, they're doing it, and they are totally following all the things that public health people want them to do. And again, 50% of America doing all those things is a very big number. Then there were their sort of fellow travelers, which we called the box checkers, which are the ones that I got vaccinated. I listened to what they said. I did the big thing. I'm sort of done now. I'm not going to stay home. I'm not, I'm going on vacation to Mexico again. I'm not wearing that, but I did the big thing. I got vaccinated. Then we called, this is, I think, the most interesting group, and a group that a lot of people were kind of disparaging of. Not everyone who didn't get vaccinated was against public health. There are lots of people who, for whatever reason, are not comfortable with the vaccine, but they were doing everything else. Everything else they were asked to do, they were doing it. They were staying home, they were wearing masks, they were talking to others, they were, they just didn't want to get the vaccine. And they weren't anti-vaccine generally. They were in the I'm going to wait and see mode. And many of them during the Omicron surge felt pretty validated because they'd been told vaccines are the silver bullet. Nothing bad's going to happen once you get vaccinated. And then we got a huge surge even among vaccinated people. And so there was some, the way people process information, that makes sense to people. It's a good thing I didn't get that vaccine. I'm going to protect myself. And then there were the unconcerned, who are all the people that you know, saw, that's what you heard about a lot in the media, were the unconcerned, who really just were not paying attention to anything that they were being asked to do. So again, I think we've got the article that you can read, and then just some guidance on messaging of how to do it well. When we say trusted messengers, trusted messaging, really get specific with people. What do you not want them to do? And make sure it's possible for them to do that. You know, there were countries that sent people masks. That's a way to get around this whole, how do you find the right mask or know if you've had, like, give them to people. And we started doing that with tests, and that worked really well. So when you ask them to do something, make it possible to do it. Again, we are very social animals. Social proof is a really powerful motivator for lots of people. A lot of the messaging and the media focused on the polarization, highlight the commonality. If we had come out and said 2/3 of Americans are wearing masks regularly, that's a very different frame than highlighting people complaining about wearing masks. Again, this idea of empowering individuals, people really felt like they had only themselves to turn to at many points during the pandemic. And how do you work with that? How do you make that powerful and get people to give them things that they are able to do and show them that they are part of the solution? And then this goes to that sort of community messenger, local story. This was a very different pandemic in different parts of the country. So how can you show people examples that they could really relate to, of this is what's happening here in Ohio or here in Pennsylvania or here in my hometown? Because people who felt that things were under control locally were much more likely to do a lot of the things because they felt like it was working around them. So that was a sort of tracking question we asked all along the way. So I've seen a lot of questions popping into the chat. And I hope those were helpful. Yeah, those were 18 months. So this is the roll-up report from, it was in the field in January, February of 2022.
Thank you so much, Carrie. I think these lessons are so important. And one thing that's just so interesting for me in all of this, and this is less a question, but more of a discussion prompt, because Ida's on the line from Internews. I see Sherry's on the line as well with her background in journalism. And, you know, and you talked about kind of the stories that we heard in the media. And what strikes me is your message of like, most people did the right thing. And yet the narrative is really around catering to the squeaky wheel, the lowest common denominator of that mix of the unconcerned, that 15%, and then the self-defenders, that 14%. And those stories and the nuance in the narrative doesn't get captured as much, or that 2/3 of Americans are doing this, and actually, like, because it doesn't get the clicks. And so there's a business model and argument here too. These are just all things that kind of strike me of our challenge as strategic communicators or behavior change communicators of how we get the right messages to land, because even if we're pushing them, they're not necessarily the ones that are spicy enough to get the attention. So I don't know what folks think about that. Carrie, what you think, but others feel free to chime in to respond to that, or just chime in with your own questions. I see Ida has come off of mute and on video.
Yes. Hi. Yeah, you know, it was really fascinating. I just actually do have a quick comment, and I think I speak for myself, I suppose, mainly, but I do think speak also for very many other journalists and the many journalists we worked with in this time. I think it took a long time for us to realize where to focus our attention. I think journalists who follow science and who were perturbed about the misinformation for a long time thought they need to persuade, convince, kind of shift the needle magnificently with all of these groups that you mentioned. It was just wrong to think that, because I think in the meantime, there's been a lot of evidence, and we've seen just from our actual implementation that it's that group that is not necessarily in denial, but just sort of in the middle and unclear and has questions that ought to be targeted much more deliberately. I think we were thinking perhaps we can get the conspiracy theorists and the folks who say there wasn't a moon landing and all of those, those in those category. I think we kind of thought we needed to bring all on board. And I think it took a long time for us in the media to realize that there is a certain percentage, a certain sector of our audience as journalists that aren't going to be swayed. And so it actually brings it to something more realistic and something certainly more very nuanced, of course, but just more realistic. The target shifted for us. And I think that we in the media learned a lot from the behavior change community in terms of, where is it worth spending energy on and where would it be an absolute waste? So I just wanted to say, I appreciate the thoughts you've just shared a lot, and we've learned a lot, and it's actually made our job easier and just more realistic, I guess. Yeah. Thank you.
Thanks, Ida. Any other? Oh, Carrie, do you want to chime in?
Yeah, one thing we did really early on, Rockefeller really focused on testing very early on. And so separate from this tracking survey, we did a bunch of focus groups with people about rapid tests, because, this whole idea of you testing yourself at home. And they were with conservative Republican leaning parents, because it was, about reopening schools and things like that. And they were 100% bought in. They understood the concept, the idea that you could test your child at home and know whether it was, safe for them to go to school. Yeah. These parents, they had been home with their kids for 6 months at this point. They were like, they need to get back to school. They need to see their friends. This idea that we're protecting them, protecting ourselves, protecting our community, and they could go to school. They were 100% bought in. That narrative showed up nowhere in the media because people weren't really... Yeah. We were framing it not as a public health good, but as a real thing, looking at the individual things that real people really cared about. They saw their kids being lonely and sad and bored and all of those things. So the benefit was not just public health. The benefit was all these other things that they wanted for their kids, and framing it that way really brought them along. And I think that was, when you talk about behavior change, like what are the intrinsic aspirational motivations people share apart from the public health action you want them to take, and matching those two things together.
Communications 101.
Completely.
Great. I see a comment in the chat from Sherry. Okay, I'll leave that to you, Carrie, to respond there in the chat. I'm conscious of time. Want to do a very quick round robin of anything that folks want to share with each other, things that you have coming up, webinars, big events, campaigns, those sorts of things. Anything that's top of mind? Diana, NFID has a webinar, on June 29th on strategies for addressing adult vaccine hesitancy. Very relevant to this conversation that we've had today. Thank you so much for sharing that. Anything else that's top of mind? I will say, from a Pandemic Action Network standpoint, from a policy and advocacy perspective, it's a very busy time. There's a big financing summit in Paris next week, which is a really critical moment to address the global financing system for countries to be able to build resilient systems to disasters. Much of the narrative is focused on climate, but Pandemic Action Network will be there because in order to build resilient systems for climate disasters, you need resilient health systems that are also resilient to pandemics, so that these things are tied together. So we have issued a policy brief that is focused on ensuring that pandemic clauses are also part of debt contingencies and lending agreements when there are disasters that happen, so that countries have the flexibility to kind of invest and move money where they need to. So next week is really critical. And then there are a variety of key moments as we're looking toward the fall. So, we already have our eyes on September, October with UNGA meetings. There's a UN high-level meeting on pandemic prevention, preparedness, and response at the UN General Assembly this year. And then also considering the finance reform agenda, the World Bank annual meetings in Marrakesh in October will be incredibly important. So lots of big policy and advocacy moments that are also wrapped into these conversations. And this group continues to be so important to ensure that communication stays a part of that. And yes, our playbook is always a good way to keep your finger on the pulse of all of those moving pieces. Thank you, Darcy. Any other reminders? I see the chat is very robust. Ida shared a piece from Internews. Excellent. Very good. With that, while we have everybody still on the line, I do want to do a bit of housekeeping because, as I noted, the time of this group is changing as of next month. So we will be meeting 2 hours earlier to greater accommodate and diversify our audience of partners in Africa, in the Middle East, and in Europe. It's very late there right now. And so Courtney Morris, if you can come on the screen and just give a little bit of a primer to show people how to update their schedules.
Hi, everyone. It is going to be so easy to just quickly make a change to your calendar. You won't have to re-register for anything. You'll just be able to go into your calendar and take a couple quick little steps, and we'll do it together. So the host has disabled participant screen sharing. Can the host make me a host, please? Thank you. So what we're going to do while we're waiting for that is to click forward in your calendar till you get to July 20th, which is the time of our next meeting. And then we'll make our edits there. Emlyn, let me know when it is ready.
You're good to go.
Awesome. Thank you. So once you get to July 20th, you're going to just right click on the behavior change communications working group. For me, that is at 9 a.m., which is 12 p.m. Eastern, and then cascades out. You just right click and then open all events in the series. And then it's going to pop up with everything. You hit edit. And then up here, you just change this 12 to 2 hours earlier, whatever it is for you. It's 12 for me. It might be a different time for you, but you just change it down 2 hours. So for me, it changed to 10. And then you hit save. And then it is going to, oh my gosh. Okay, I did it a little bit wrong, but that's okay. Everyone's watching, but it's totally fine. So I'm gonna open it again. And then it just thinks that it's still in the PM because I started in the PM. That's a life rule. You wake up in the morning, in the AM. We're going to make it 2 hours earlier. Now it should be in the right spot. When you hit save, it's now been moved. Oh my gosh. Okay. There you go. It should work for everybody. Let me know if you do not feel like it's working for you. It should just easily move it 2 hours earlier, as long as you've got your times correctly and your AM PMs sorted out. If you have any issues, my email is can be put into the chat and into the notes, and please just reach out if you have any issues at all. We'll send out lots of reminders next month so that it's really easy.
Thank you, Courtney. Yes. As we're all communicators, there will be frequent communication on this to remind folks so that we all arrive at the right time in July. And our last plug is each year we ask our partners for feedback so that we're constantly iterating and improving the network experience. We are a partner network after all. So we'll put the details in the chat. You probably received an email from us as well, right at the top of Playbook today. Again, repetition, repetition, repetition. And we would love for you to take 10 minutes and complete our survey and provide feedback. It's incredibly helpful. We do listen to this feedback. So thank you for taking the time, and thank you all for sharing today, taking the time to be with us and continuing to do such important work in the world. With that, have a great day. Darcy, we wish you your voice back, and we look forward to seeing you all next month. Bye.
Bye.